Hey guys, it's Sarel Gaur MD, and today I'm going to be talking about spinal stenosis. So the first question is, what is spinal stenosis? When we're talking about spinal stenosis, we're talking about the spine, we're really talking about the spinal canal. We're talking about the bony canal which holds the lower spinal cord and the nerve roots, which are the cauda equina. And when we say stenosis, we're talking about narrowing of that region. And it's the narrowing of these nerve roots which leads to symptoms which include back pain, shooting pains going down the leg, numbness and weakness in the lower extremities. So this is actually a patient here that has spinal stenosis basically at this level, which is the L4, L5 level. He also has some disease at the L5S1 or the lumbosacral level, and I can show that here on the axial. First, let me show you what a normal lumbar spine looks like. Here you can see a normal lumbar spine. You can see a nice, gentle lumbar lordosis. You can see that this region here, and by the way, this white signal here is fluid, which surrounds the cauda equina nerve roots. You can see how nice and open this region is and how full of fluid it is. And when I'm looking on the side view, you see how it cuts through this region. You can see that there's a nice round contour of this spinal canal and this thecal sac, which is basically this dural-lined sac which contains the nerve roots inside the CSF, the fluid, the cerebrospinal fluid. Now we're back to our abnormal patient here. So I just want to point out, first of all, the curvature is completely different. We have a basically straightened lumbar spine, and here we have some abnormal findings, and I'll go through those in detail. Basically, there's narrowing of the central canal here. On the axial, you see that as loss of CSF signal. If we come up to a more normal level, you can see nerve roots floating in a round CSF or fluid-filled column. When we come back down to the abnormal level, that CSF is completely lost. So why is that lost? It's due to basically disc disease. This disc is flattened and lost its internal fluid. You can see a more normal disc at this level, which has volume and also has fluid, as evidenced by this high signal or white signal here centrally. So you can see that's all gone. And so back here on the axial, we can see that disc is basically enlarged. This would be called a disc bulge. Other things that are contributing to narrowing: enlargement of this facet joint, which is a joint in the posterior elements of the spine. We have thickening of this ligament right here. So I hope this video was helpful. I hope you can see what spinal stenosis means and how it shows up on MRI and how we diagnose it as radiologists. If you like this video, please subscribe to my channel and for additional content. Once again, I'm Sarel Gaur MD. Thank you for watching.